Rule number 1, know your enemy. Eyes up on the screen, everybody.
Did I say low intermittent suction or gravity?
Pop quiz. Is he yelling or talking? Jenny? He's definitely yelling. I'm getting toxic masculinity vibes. Common mistake, Jenny. This is a general surgeon. Their default aggression and volume is set higher than average. So if you don't know that going in ahead of time, that can really fluster you, okay? All right, pop quiz, what type of physician is this?
Let's run normal saline at 100 cc's per hour, nurse. You know what, though? He does have heart failure. Let's back it down to 50 cc's per hour. You know what? I just thought of something, though. His chloride is high, so we better switch it to lactated ringers, okay? Dang it, you know what, though? His potassium is also high. So let's do D5 half normal saline at 75 cc's per hour. Oh, man. I just remembered, though, he's also diabetic. His sugars are going to be running super high on that. You know what? Let's just hold off on fluids altogether.
Is it critical care? Common mistake. This is actually a hospitalist. The telltale sign, the indecisiveness. They overthink everything and end up doing nothing most of the time. Critical care doctors actually like to do stuff. That's how you can tell the difference. Okay, let's see who can get this next doctor right.
Just tubed him like a lazy river, Muhammad Ali. Wow, I'm impressed, sir. Even the DART team had trouble with this patient last time. What vent setting should I put him on?
Blow him up like a pufferfish, Robert Downey Jr.
Haha, good one. But seriously, like volume assist, pressure support.
Assist and support, bro V-Wade. Hey, I got some more fires to put out around the department. You got this, bruh.
What's the plan, Doc? Are we bolusing him fluids, antibiotics?
Just tank him up and marinate him in vancomycin, Bill Bro Baggins.
Okay, you're gonna put those orders in, right, sir? And he's gone.
Okay, he was good in a critical situation, so it must be critical care this time. Not even close, Jenny. This is an ED physician. They're very good in a pinch, but they lose interest when it comes to formulating a long-term plan or putting a lot of orders in the system. The difference between them and critical care will put in more orders than a shopaholic on Black Friday. Okay, let's do sort of a lightning round. I'm going to show doctors responding to a code and you tell me what type of specialty they are. Whoa, what's up, Rodeo Drive? What say we keep this dude alive? Janice, no way. How are the kids? Can you put them on non-rebreather and hook up the pads? Thanks, babe. Craig, play his chest like the bongo. Cindy, you're here too. How's your grandma doing? Can you put on Bee Gees Staying Alive?
Is that so we keep the chest compression rate accurate, sir?
Nah, it's just a killer tune, bruh.
Sir, are you gonna just stand there or are you gonna help us run this code? So you're just gonna stand there frozen in fear, is that right?
Sodium bicarb?
Damn it, this never would have happened if y'all had listened to instructions.
Number 1 was ortho. Number 2 was ED. Number 3 was frozen in fear, so it must be a hospitalist. And number 4, he was mad for no reason, so it could be any type of physician, but I'm gonna trust my instincts and go with general surgery. Perfect score, Jenny. I'm so proud. Class dismissed, everybody.
I don't know why you call yourself Sleepy Man. This patient wide awake.
I don't call myself that, Ortho. You're the only one who does. I'm an anesthesiologist, and I find that nickname offensive.
I changed it to Torture Man. Make more sense anyways.
I'm sorry, but it's difficult with all this periosteal stimulation and surges in sympathetic tone.
Yes, boring talk is working. Keep it up, Sleepy Man.
It's called medical terminology, and it's the language we use as physicians to communicate with one another.
No, it's fancy talk. Designed to confuse. Speak plainly.
I'm saying it's hard to keep the patient asleep with all the hammering and drilling.
Huh? How else can Ortho fix bone?
It just seems so primitive.
The P word, man? Come on, that's just hurtful. Ortho can't help the way he look. Do I need to call HR?
My bad. I forgot that word's offensive to you. I'm just saying, can't we use some of that new Chinese bone glue or something?
No! Bone glue is witchcraft. Bones need tough love, hammers and nails, not potions and snake oil.
Fine, let me adjust the meds.
He too stiff now. Ortho cannot fix stiff bone.
You're a stiff bone.
What'd you say to me?
Nothing, just loosening the bones for you.
Finally, Ortho can work now.
By the way, we had to cancel the 3:30 case.
Why? He was strongest patient. Bones like mastodon.
His EKG looks really funky.
No, squiggly lines is witchcraft. They mean nothing. You have to look with eyes and feel bones with hands. He had thick core and sturdy bones.
Are we still talking about a human here?
Well, any primate, really.
Sorry, Ortho. That case is a no-go until cardiology clears him.
Damn you, sleepy man!
66-year-old female with dizziness. Stroke alert, next. 22-year-old female who came in for blurry vision, but she actually just realized her glasses were smudged. Better safe than sorry. Stroke alert, next. 36-year-old male with excessive flatulence. Silent but deadly, or all bark no bite? Gross. Why does that matter? It doesn't. Stroke alert him. But why stroke alert? Gassy at night, doctor's delight. Gassy by day, scan away. 60-year-old male with seasickness. Stroke alert him. Really? Why? 1 if by land, 2 if by sea. If the patient is dizzy, a scanning we be. I'm sorry, but this sounds like old sailor superstition, not medicine. Ginny, I don't expect you to understand this, but running an ED is a lot like being the captain of a ship. Next patient. 55-year-old male with arm numbness. Which arm was it? Left. Call internal medicine for a chest pain admission. But the tropes aren't back yet. Awesome. That means we have the upper hand. Plausible deniability. Oh, this next one's just to sleep it off. How did this rum-soaked tar end up on my vessel? What? Oh yeah, the ship thing. Well, he was slurring his words. Stroke alert him. But his ETOH was 200. It's a classic red herring, Jenny. What does that mean? It means we don't anchor, Jenny. Wait, are you talking ships or biases? Both. Steady as she goes. Hold the course. Stroke alert. This one's a slam dunk. 87-year-old female with sudden onset facial droop. Treated for Bell's palsy and discharge her.
Ortho looking for emotion, man. Need capacity eval.
Cheerio. Nigel Foggybottom, world-renowned psychiatrist at your service.
Patient no want ortho fix broken bone.
Oh heavens, why not?
Patient says something about already in hospice. Just want comfort care?
Well, that actually sounds quite reasonable.
No, nothing reasonable about leaving bone broken.
Does the patient know who they are and what's going on?
They are Homo sapien. Homo sapien have weaker bone than ortho. Bone broken, ortho fix.
Let me rephrase. Does the patient know their own name and where they are?
Ortho deal in physical world. Have no time for thoughts and feelings. That for emotion, man.
Okay, I'm coming immediately. Do not touch them until I can perform a full psychological evaluation.
Oh, please hurry. Ortho jonesing for a bone fix. Real bad. Don't know how long I can hold out.
Hold that thought, young man. Somebody's phoning me. Nigel Foggybottom, world-renowned psychiatrist.
Sup, Sigmund? Got a psych consult for you. This dude's speaking in tongues.
That's interesting. His chart says that he's Spanish-speaking.
I don't think so. I asked DeLorean El Pecho, and he said no.
Perhaps he does not have any chest pain.
It's the ED, Freud. They all have chest pain.
Fine, I'll come see him.
Awesome. Hey, I got another one while you're down here. A dude with possible suicidal ideation.
Did they express suicidal ideation?
Not exactly, but he looked really bummed out.
Did you even ask specifically if he has suicidal ideation?
No, I was scared. What if he said yes?
Listen, old chum, if you're worried, simply Baker act him.
Pretty sure only you Carl Jung types can do that.
I think you mean Carl Jung?
No, the dude I'm thinking of is really old.
Never mind. Actually, any physician can initiate a Baker Act.
I think I would know that.
You would think, wouldn't you? It's fine, though. I'd be out of a job if all physicians performed their entire scope of duties.
You said duties.